Okay, so we have at 0700 an order for 6 units of insulin subcutaneous. So we've got our insulin syringe and our Practice insulin. This says Practice insulin NPH, 100 units per milliliter. The order is for insulin NPH, 6 units, and it is not expired. So, knock on the door. Hi, Mr. Pitt. I am here for your insulin injection. Can you state your name and date of birth for me? Perfect. And let me see your armband. Perfect. Okay. So we are going to give you 6 units of insulin to help with your blood sugar. It was ordered for 7 a.m. It is 7 a.m. now. And so I will go ahead and draw this up. All right, there's 6 units. And this is going to be subcutaneous, so we're going to go right under the skin. We could do this in the belly, the scapula, the arm, the thighs, or the lower back. We'll go with your belly for this one, but away from the umbilical. So we're going to come in at a 45-degree angle after we've wiped down the skin and inject. All right. And put the cap up for safety. All right, Mr. Pitt, I'll be back in a little while for your morning meds. So at 0900, we have 60 milligrams of Lasix, I think is what LASI is. In this case, it's furosemide. So we've got 60 milligrams of that PO, and we've got 20 milligrams of Prilosec PO. Okay, so for our 60 milligrams of furosemide, they come in 40 milligram tablets. So we would open one and then open another one and do that one with a pill splitter, do half of it. So we've got 1.5 of these pills in there. And for the Prilosec, it comes in a 20 milligram capsule. It's not expired. Neither is the furosemide. They're not expired. They do match the MAR for the name of the drug. And we've got the dosage correct. And these are both going to be administered at 0900, and we've checked the MAR to make sure that there's no allergies for these. So I will enter. Good morning, Mr. Pitt. My name's Stuart. I'm your nurse today. I've got your morning meds here for you. This morning we're going to get you some furosemide and some Prilosec. You know what those are used for? You've been taking those? Excellent. All right, and let's see. All right, are you comfortable taking 2.5 pills at one time? Excellent. All right, so I'm going to put the Prilosec in there and the 1.5 of the furosemide in there and administer to the patient. Make sure that they're down before I leave the room. And that's that. And let's see, next we will have, at 10 a.m., we're going to have potassium, amoxicillin, and diltiazem. Let me gather those things. So, potassium, we are going to give 16 MEQs. Alright, they come in 8 MEQ tablets, so we've got 2 of those. And we've got amoxicillin 250 milligrams. That comes in a 250 milligram tablet. And the DILT is 360 milligrams. That comes in a 180 milligram capsule, so we've got 2 of those. Alright. So the first thing we're going to do is read the drug, practice diltiazem. It matches the MAR. Potassium chloride tablet matches the MAR. And amoxicillin matches the MAR. None of those have expired. They all expire in 2022. So we check that. And let's just confirm our dosages. For the potassium, we're looking at 16, and they come in 8 milligram capsules. So we've got 2 of those. Amoxicillin is going to be 250 milligrams. We've got a 250 milligram capsule. And the DILT is, the order is for 360 milligrams, and they've got 180 milligram tablets. So we'll be giving 2 of those. All right, so knock, Mr. Pitt, good morning. Can you verify your name and your birthday for me? Excellent, and I'll take a look at your armband. Perfect. This morning we've got some potassium for you, as well as some amoxicillin and some diltiazem. Are you aware of what all those drugs do? Have you been taking those regularly? Cool, okay. Should be no problem then. And this is going to be a little bit. So we've got 5 pills total here. So are you able to take all 5 at once, or do you want to do one at a time? Okay, we'll split them up. We'll do the potassium first, and then the amoxicillin with the DILT after that. So I'm going to take your potassium. We've got 2 tablets in here. That's going to total 16 MEQ. So we'll take those, put them in here, and give them to the patient, and they're down. And then we'll take another medicine cup. And this one we're going to put the amoxicillin and the diltiazem in it and administer it to the patient. All right, perfect. And how are you feeling this morning? Good? Are you in some pain? You are? Okay, well you've got some morphine ordered as needed if you need it, and it's been over 4 hours since you've had it, so you can have some of that if you'd like. What's your pain on a scale of 1 to 10? Okay, excellent. Well, let me see, let me go grab some morphine for you and we'll get that started. I'll be right back. Okay, so the PRN order is for morphine sulfate, 10 milligrams per milliliter. And we've got morphine sulfate, 10 milligrams per milliliter, and it is not expired. So that's the right drug. We'll knock on the door. Mr. Pitt, can you verify your name and your birthday for me? Excellent. We're going to get you this morphine to help out with your pain a little bit. This is going to be an IM injection. So we're going to do this. Let's see, it's a small one, so we'll just go in the arm. It's going to be just a real small injection here. All right, verify name, birthday. Know why we're taking this drug. We're going to take it for pain. So we've got this morphine is 10 milligrams per milliliter, and the dosage that is ordered is 2 milligrams. So we need basically 1/5 of 1 milliliter in IM injection for this drug. So we're going to drop 1/5 of 1 milliliter, which will not be much, but it is indicated on this syringe. Those lines are there. So we'll take this and shake it around a bit. And we will draw 0.2 or 1/5 of 1 milliliter. And we've got that there. We will be doing this in the patient's arm right here. So we wipe it down with an alcohol wipe, and then this be the patient's arm. We're going to pinch the skin up a little bit, insert, administer the drug, pull out, cap it back for safety, and that is that.